We know that having hernia surgery, or any surgery, is a very anxiety-provoking experience. Myself, along with all of my staff, both at my office as well as at the surgery center, want to make this as stress-free an experience as possible. We want you to know what to expect beforehand, what to expect during, and what to expect after your surgery. To start, we tell patients to stop blood thinners 5 days ahead of time, whether Coumadin or aspirin. This obviously helps decrease your risk of bleeding during the surgery. We may require some blood work, may require an EKG, all of which my office will have taken care of days ahead of time so that you can just focus on showing up for your surgery. We ask you to not eat or drink anything 8 hours before your surgery, and we ask you to show up about an hour ahead of time. That hour gives you a time to get to the center, fill out any paperwork, and for the nurses to get you prepped and ready for surgery. Getting you prepped is pretty easy. They simply put an IV in so that we can give you the sedation during the surgery, and we'll give you antibiotics before your surgery to minimize any chance of infection. Once the anesthesiologist has seen you and I've seen you, we'll give you some sedation, we bring you in the operating room, and the surgery itself usually takes about an hour. Once your surgery's over, you'll be in recovery room for about an hour. We encourage family members to come back and recover with patients, so as soon as you're awake and stable, the nurses will bring back any family members so that they can be there with you during your recovery. After approximately an hour, usually all the anesthetics have worn off, and we allow you to leave the center. You have to have somebody with you for the surgery, meaning that you have to have an adult with you to take you home because of the anesthetics that you'll have been given. If you have a family member, that's great, or a friend. If you don't, and you're traveling from out of town, there are nursing services and nurses in our area that specialize in taking care of patients after surgery. My office can arrange those things with you if needed. Once you leave the center, we tell you to have someone with you for approximately 12 to 24 hours. We encourage them to pick up the pain prescription on the way home so that you have that for when you get home at night. So myself, my office, as well as our surgery center, wants to make your experience as easy and as stress-free as possible. We encourage you to call the office or email us if you have any questions. We're always here to help.